Good morning, ladies and gentlemen. Welcome to the first annual health awareness campaign. What does this entail? What is this about? Well, I'll tell you a little bit about it. As we all know, we live in communities where things might happen, unfortunately. Sometimes we're not always in the best of health and we end up in the hospital or in another clinical setting. And for that reason, I decided to focus on receiving the best quality care that you can, but also preventing other complications that when you go to the hospital, you might not have it, but once you're there, you can acquire for, in this case, an infection. Infections are everywhere. We can get them just about from anything. But what we want to focus on is you, the client. Make sure that you receive the proper care that you deserve. But on top of that, we also want to take care of you. We want you to be in the best clinical setting, clean, safe. That way we can provide effective care. One thing that I was focusing on when I did my research was focusing on the intensive care unit. Clients that are there, they need more attention because of their health status. And for that reason, they're more vulnerable to infections or complications that might decline their health quickly. So when I started observing. And one of the things that I observed was that there were mobile computers, mobile laptops, computers, and they were being taken from one room to the next in between patients, that same computer. During my observations, I also noticed that sometimes after assessing a patient, having that, giving them medication, having that interaction with them, some healthcare workers were not sanitizing their hands between caring for the patient and documenting in the computer. I believe that these are opportunities for transmission of pathogens, and that was what my focus was about. So what I did, I went into the intensive care unit for 5 different days working the shifts in the morning, and everything that I saw, I was documenting, and just wanted to see how a daily interaction with the patient, with the healthcare workers, the groups that were involved, uh, doctors, nurses, social workers, pharmacists, um, physical therapists, and I started to see a pattern, um, which again, um, the problem that I encountered, or that I was able to identify again, were how pieces that were inside the room, the clinical, the patient's room, all the monitors, all the ventilators, um, specifically, again, like I said, the portable computers that were being used in the clinical setting. So what we were supposed to do, or what we're supposed to be doing, is every time you use an equipment, we're supposed to wipe it down, sanitize it between use. Throw that away, and once you do that, sanitize your hands, and then you can start documenting on the computer. I also noticed that on some occasions the computer where the monitor is at, where the computer was at, there's certain like spaces, and there some of the nurses were opening up the medication and putting it together. They were not doing it next to the patient or in a separate table that was assigned for that room. And again, this becomes an opportunity for risks for infection. So some of the information that I got, or that I started researching, was from the Journal of Intensive Care, the National Library of Science. Specifically, the document that I read, or the journal, was called Evidence of Equipment and Commonly Used Object Contamination in the ICU. So this article talked about how everyday use equipment was supposed to be sanitized, or how we were supposed to be handling it in order to avoid any transmissions. They had devices that, such as the support equipment, life support equipment, and patients that had CVC catheters that needed special care, special attention, and most importantly, the way that you were handling it, sanitized hands, gloves, clean gloves, all that is important to maintain a clean area and avoid infections to start growing. In this article, it stated that the majority of cases of contamination were due to electrical equipment. Um, so this might include all the equipment that has to be plugged in, you know, even the cords. Once you're done with them, clean the machine, clean the cord, and then store away. Or if you're gonna take it somewhere else, make sure everything is well cleaned and sanitized appropriately. The way I would operationalize the practice change in the intensive care unit would be through a program that would be called Health Awareness Campaign. It would create, I would personally create videos, slides, posters, and place them in strategic areas. So this is the way we would start. You know, just reminding everybody of the importance of hand hygiene, how to handle equipment properly, how to dispose of equipment properly, to keep not only the client safe, but also keep all of us safe, all the healthcare workers. And so again, I would create just posters and actually place them in strategic areas. Some of the places where I would place one of those posters or a picture would be next to computer stations, outside every ICU room, also next to the bathroom doors, as well as the nurses' stations, hallways, and places where other healthcare workers pass by on a daily basis, as a reminder of the importance of practicing these safe procedures. And so the theory that I used for my campaign was an environmental theory. Why environmental? Well, environmental because we want to create a safe environment, you know? And I thought there was a lot of really good points in that theory, which align or parallel with my idea of making this campaign successful and a great opportunity. This theory came about from Florence Nightingale, which she stated that the importance of positive patient environments for the recovery, curing illnesses, and meeting health goals. It also talked about or went into more detail how to manage, basic stuff like light, ventilation, noise. And then this one was the one where I was like, okay, cleanliness of the facility, bedding practices, personal hygiene, food safety, and patient support strategies. That is a great way of just putting everything together. If we do all these things, the risks of hospital-acquired infections in the ICU would be lowered or minimized. So this is the reason that I chose this. I will overcome barriers, if there are any barriers, by providing evidence-based research and data so that it is accessible for the employees. Any barriers will be addressed with courtesy and facts of why this program was brought about. I will take the time to answer any questions, any concerns, according to their priority, or any other comments or even ideas will always be welcome. The point is, we want to be transparent with everybody. Anything that we do, always be transparent, always be honest, and always be willing to be open to any concerns or questions. Ethical considerations for my research would be to understand the importance of practicing adequate hand hygiene, as well as proper equipment disinfecting after each use to reduce the risk of cross-contamination. Very important. You know, that's our main focus, is a client. How are we taking care of them? That's our moral responsibility. We're taking care of a human being, and we want to do it the best way we can. Sources of internal evidence will be used by using the school library, also journals, also peer reviews, as well as other universities, if they are just reliable resources. Okay, and then how will I evaluate the outcomes of my change project? Well, we will be evaluating all this with creating a checklist with all the procedures that have to be performed on a daily basis. Whoever's doing that performance will put their initials, legal document. We will have a special or specific place where we will place all those documents, and then we will also have monthly employee meetings to address any issues or concerns. We will also discuss new cases if there ever comes one up, and pinpoint what caused the transmission. Why do we want to do that? We want to do that because we learn from our mistakes, and if we can identify that mistakes, we can avoid future incidences specific to how that transmission happened. And lastly, the way I will disseminate any findings of the research will be by providing all the data to the upper management, as well as a team that is focused on infection control. From there, we would contact reliable resources to see if a publication of our findings would be possible to print or share with the rest of the medical community through the internet. Why do we want to do that? We want to do that because as a healthcare team, we always want to support other healthcare places if they're having similar problems, issues. We are a big community. We should embrace that. We should always put patient healthcare first, and if we can always provide positive feedback or information, as well as us, them, any other organization that might want to give us some feedback on how to do things different, better, and all for the patient, we will always welcome that. It's important. Thank you for your time. Thank you for listening to my research. Thank you.